Thank you for your statement, Cabinet Secretary. And I would also like to place on record my thanks to all the dedicated staff for the way that they've handled pressures this winter. Spring is just around the corner, but our NHS remains in the depths of a winter crisis, with many operations being cancelled, and therefore we cannot move on. I should rephrase that because the term winter pressures gives the impression that pressures upon the NHS in winter are unique. Unfortunately, they are not. Our NHS is facing spikes in demand year-round, often made worse by the backlog created as a result of dealing with winter pressures. The only thing different about the winter months are an increase in respiratory illnesses and perhaps a spike in trips and falls due to snow and ice. So far, winter 2017-18 has been much milder than 2010-11, and flu rates have been lower. So why, after so much planning and investment, is the NHS struggling more this year? At this stage, in 2010-11, consultations for influenza-like illnesses were nearly double what they are today, and 86% of patients arriving at A&E were discharged within the 4-hour target. Cabinet Secretary, do you believe that the very fact that we had 2,000 more beds and occupancy rates below 85% enabled the NHS to cope better back then? And also, Cabinet Secretary, although consultation rates for influenza-like illnesses are much lower than in 2010-11, they are still much higher than the seasonal average. So do you agree that the decision to offer the cheaper trivalent vaccine, which does not protect against the most prevalent B strain, is the biggest contributing factor to the spike in flu cases? And will you now opt for the slightly more expensive quadrivalent vaccine, which protects against B Yamagata or Japanese flu, the most prevalent B strain this winter? It is clear that we can't afford to continue approaching seasonal pressures in the same fashion. And while we look forward to your vision for the future of our NHS, this winter has made it abundantly clear we need radical changes now. So, Cabinet Secretary, our NHS needs better signposting for patients, and while the Choose Well campaign is a step in the right direction, it is still not having the complete desired effect. So what plans do you have to expand the 111 service to cover the whole of Wales and to act as a gateway to services, signposting patients to the most appropriate resource, whether that's a pharmacy, a primary care team, A&E? And I was also concerned to hear via a meeting that those training to be GPs, only 30 to 40% have stated that they are willing to work out of hours. I think this is a great concern to myself and to other people. And finally, Cabinet Secretary, how do you plan to bolster NHS resources so that we aren't having this exact conversation in 3 months' time, 6 months, and again this time next year? Thank you very much.
Cabinet Secretary.
Thank you for the comments and questions. I wish that spring really were around the corner, but as I said earlier, there can be no guarantee that winter neatly comes to an end on St David's Day. And I would say that winter really is different. I just don't think it's correct to say that the pressure is year-round and it's no different in winter, and we just have a bit more respiratory illness. In going around emergency departments right across the country, there's been a very consistent theme that is borne out in the facts and figures in the numbers of 85-year-olds in our hospital emergency departments and hospital beds. And that is that in winter we do see a larger number of very sick, very frail people, or often much older people. And that is what creates the pressure, because the numbers go down, but actually the challenge and the demand for the hospital capacity for really sick people who need to be in a hospital bed goes up. And more of those people will spend more time in our A&E units and in our hospital beds, and that is what creates much of the pressure, and indeed pressure in local healthcare as well. That's why I announced the relaxation of the Quality and Outcomes Framework too. And again, much of our conversation otherwise ends up being about ambulances and hospitals. On bed capacity and flu, I think I dealt with those points in answer to the first set of questions from Angela Burns. We will, of course, listen to the evidence from Public Health Wales, their surveillance evidence on the circulation of flu, the type of what we should do for the next year. On 111, again, in response to Angela Burns' question, I indicated that we would have something on a national rollout for 111 over the coming years. And on pharmacy, I'm really pleased that you mentioned a number of things we could do differently with Choose Well. Choose Pharmacy being one part of that. The last time I updated members, 60% of pharmacies in the country had the Choose Pharmacy system. It's now 66% of community pharmacies have access to Choose Pharmacy. That's a real success story. And we are piloting a rollout of further access to the GP record in community pharmacies. I'll know more about that at the end of March to make a different choice. And in that, we are ahead of both Scotland and England in actually having that greater access for our community pharmacies. So we're investing in different parts of our system to give people opportunities to access that advice and support in every community on a much easier basis.
Thank you. Finally, Jenny